sometimes acid comes up, and it's called reflux or heartburn. It's called heartburn because it's coming up and it feels like your heart's burning. And I have friends, doctors, nurses who worked in casualty, or you call it emergency, I think, and people come in thinking they're having a heart attack, but it's actually heartburn.
60 or beyond, life brings both wisdom and new challenges. One of the scariest moments any senior can face is experiencing a heart attack, especially when you're completely alone. Perhaps you're sitting in your favourite chair, reading the newspaper or tending to your garden, and suddenly an uncomfortable tightness grips your chest. You may shrug it off as indigestion, fatigue, or even stress. But the truth is, heart attacks in seniors often present subtly, and seconds can become critical. And in today's video, we're going to explore 7 life-saving strategies every senior should know if they find themselves experiencing a heart attack alone. These tips are rooted in science, medical experience, and practical reality, nothing theoretical, nothing hypothetical. I want to speak to you directly today because what I'm about to share could very well save your life or the life of someone you love. Heart attacks are one of the leading causes of death among seniors. And the scary truth is that many happen when you are completely alone. Perhaps you're in your living room enjoying a quiet morning coffee or getting ready to take a stroll in your neighbourhood, and suddenly you feel that tight, heavy pressure in your chest. Maybe it radiates to your arm, jaw, or back, and panic sets in. This scenario is more common than most people realise, and the difference between life and death can be a matter of minutes. Over the years, I've spoken to countless seniors who have faced this terrifying reality, and I've seen both outcomes, the heartbreaking ones and the miraculous recoveries. Today, I want to guide you through practical, science-backed strategies that can dramatically increase your chances of surviving a heart attack, even if you are alone. Before we begin, let me tell you this. The body gives you signals, sometimes subtle, sometimes urgent. A tightness in the chest after climbing stairs, shortness of breath while doing simple household chores, or sudden dizziness could be warning signs. Recognizing these early is critical, but knowing what to do if the worst happens is even more vital. Please remember, the guidance I share today is educational. It is not a substitute for medical advice. Always consult your doctor before taking any supplements, herbs, or starting a new exercise. Now let's dive into the first life-saving strategy. Before we start, drop in the comments from where you are watching this video and what health topic you'd like to see in the next video. As a special thank you for joining us today, we're giving away 100 free copies of my best-selling book to subscribers. So if you haven't already, make sure to hit that subscribe button and leave a comment about why you want to win my best-selling book. Tip 1, recognise the early warning signs and don't ignore them. Many seniors underestimate or dismiss the warning signs of a heart attack. You might feel mild discomfort, unusual fatigue, or an unfamiliar pressure in your chest and think it's just indigestion or I'm tired today. I cannot stress enough. Paying attention to these signals could save your life. Heart attacks often start slowly. The pain can be subtle, intermittent, and sometimes mistaken for muscle strain or a bad back. You may notice a sudden shortness of breath while performing a task that used to feel easy, or a tightness in your shoulders and arms. Some seniors even report nausea, cold sweats, or lightheadedness before the more intense pain begins. These early signs are crucial cues. Acting immediately, even at this stage, can prevent a full-blown heart attack. Here's a real-life scenario. Mrs. Thompson, a 68-year-old retired teacher, felt a strange heaviness in her chest one afternoon while watering her plants. She shrugged it off, thinking it was just a little indigestion, but she remembered reading about early warning signs and decided to sit down, loosen her clothes, and call her daughter to check in. Within minutes, the discomfort intensified. Because she recognized the warning signs early and took action, emergency services arrived quickly and she survived with minimal complications. Recognizing the warning signs is not about being fearful, it's about being informed and prepared. This awareness gives you precious minutes to act, minutes that could mean the difference between life and death. Always trust your instincts. If something feels off, treat it seriously. Now, once you've recognized that something is wrong, the next step is immediate action. And tip 2, call for help immediately. Even if you're alone, the first and most critical action during a heart attack is to get help. Every second counts. Even if the discomfort seems mild or fleeting, calling emergency services immediately can drastically improve your chances of survival. Many seniors hesitate, thinking, I don't want to bother anyone, or it might go away. But during a heart attack, hesitation can be deadly. If you are alone, it's essential to have a plan in place. Keep your phone within reach at all times, whether you are in your kitchen, bedroom, or bathroom. Some seniors even keep a cordless phone or a mobile device in each room. When you feel chest discomfort or any of the early warning signs, do not wait. Call emergency services right away. Clearly state your symptoms and your age. Remember, medical professionals are trained to handle these situations and will guide you step by step. Here's a practical scenario. Mr. Jacobs, 72, was sitting alone watching his favourite morning program when he felt a sudden pressure in his chest and dizziness. He knew he lived alone and could not risk ignoring it. He dialed 911 and stayed on the line while following the operator's instructions. The paramedics arrived in under 10 minutes. Because he acted promptly and didn't try to tough it out, he survived with minimal heart damage. Even if you think the discomfort might pass, do not delay. A heart attack can progress quickly, and the faster help arrives, the more likely you are to recover fully. If possible, keep a list of emergency contacts near your phone and consider wearing a medical alert device that allows you to call for help at the push of a button. Remember, this is not about panic, it's about being proactive. By calling for help immediately, you give yourself the best chance of survival and minimize long-term damage to your heart. Once help is on the way, the next step is to manage your body and heart safely while you wait. Take a moment now to reflect. Have you prepared an emergency plan for yourself at home? Comment below if you have one, or share what steps you think you might add. Preparing mentally for this moment could make all the difference. Tip 3, stay calm and manage your breathing.
Basically, I was rewiring my brain. God gives us choice. So we have the choice whether we want to do it or not. And so I started to form new habits. So I'm going to give you an illustration of how this happens. So let's give the illustration, and I'm going to give the illustration of a lady who used to get panic attacks. Notice what I said? Used to get panic attacks. And she had a really strong panic attack pathway there. And she came to our health retreat. And she said, oh, I have to tell you, I get panic attacks. Do you know you can't? You actually can't just get a panic attack. So what I did was I put my detective hat on. We should all be private investigators, investigating why these things are so. I said, tell me when you got your first panic attack. She said, oh, a guy at work was diddling the books and I blew the whistle on him. That night I got a brick through my front window. Whoa! She panicked. Do you know that's a very normal thing to do? In fact, if she didn't panic and run out the back door, another brick might have come in and hit her in the head. You see, sometimes a panic is a very real and normal and understandable reaction. But can you see what it did? It made a strong pathway in her brain.
When a heart attack strikes, your body's natural response is often panic. The heart races, the mind fills with fear, and breathing can become rapid and shallow. While this is a normal reaction, staying calm is critical. Panic can raise blood pressure and strain your heart further. Focus on taking slow, controlled breaths. Sit down in a comfortable position, ideally with your back supported and knees slightly bent. This reduces the workload on your heart and helps prevent fainting or dizziness. Place one hand over your chest and the other over your abdomen. Inhale slowly through your nose for a count of 4. Hold for a moment and exhale through your mouth for a count of 6. Repeat this pattern to help stabilize your heart rate and oxygen flow. Sometimes seniors try to lie flat on the floor thinking it's safer. In reality, sitting upright or semi-reclined can help your heart pump more effectively and ease breathing. Keep your movements minimal and avoid standing up or walking around unnecessarily. Even small movements can increase the heart's demand for oxygen and worsen damage. Consider this. Mrs. Patel, 65, experienced sudden chest tightness while alone in her kitchen. She felt panic rising but remembered to sit and focus on controlled breathing. While waiting for paramedics, she maintained her composure, reducing the strain on her heart. By the time help arrived, she was stable and fully alert, allowing the emergency team to administer treatment efficiently. Remaining calm is not just psychological, it's physiological. Your body responds to your mindset. The calmer you stay, the easier it is for your heart to function during this critical window. Once you've stabilized your breathing, the next essential step is medication if available. Tip 4, take aspirin or other prescribed medications immediately. One of the most effective ways to reduce heart damage during a heart attack is timely medication. If you have been prescribed aspirin or nitroglycerin by your doctor, this is the moment when taking them correctly can save your life. Aspirin, in particular, works by thinning the blood and preventing the formation of additional clots that could block your arteries. If you feel the warning signs of a heart attack and you are alone, chew a standard dose aspirin, usually 325 milligrams, unless your doctor has told you otherwise. Chewing is important because it allows the aspirin to enter your bloodstream more quickly than swallowing it whole. This simple action can slow the progression of the heart attack while you wait for emergency services to arrive. Nitroglycerin, often prescribed to seniors with known heart conditions, helps to relax blood vessels and reduce the heart's workload. If your doctor has prescribed it, follow their instructions carefully, place it under your tongue and avoid swallowing. Remember, never take medication that is not prescribed specifically for you, as this can create more complications. Consider this example. Mr. Rivera, 70, had experienced mild chest discomfort earlier in the day. Recognizing the warning signs, he immediately took his prescribed nitroglycerin and called 911. While waiting for help, he also chewed an aspirin he kept handy in his kitchen. These actions reduced clot formation, helped keep his arteries open, and allowed paramedics to stabilize him with minimal heart damage. Even if you are unsure whether it's a heart attack, taking aspirin while waiting for professional help is generally safe for most seniors as long as you have no known allergy or history of bleeding disorders. It is a small action that can make a massive difference in survival rates. Now, while medication helps chemically, there's another critical way to support your heart physically: managing your position and movement. Tip 5, assume the optimal position to reduce strain. During a heart attack, how you position your body can influence the severity of the attack. Many seniors instinctively lie down flat on a bed or the floor, but this can sometimes make breathing more difficult and increase strain on the heart. Sitting upright or semi-reclined is generally the safest approach. Sit in a chair or on the edge of your bed with your back supported. Keep your knees slightly bent and your feet flat on the floor. If you can, lean slightly forward, resting your arms on your thighs or a table. This position reduces the heart's workload and allows your lungs to expand more fully, helping you breathe more comfortably. Avoid standing or walking unless absolutely necessary, as even minimal exertion can increase oxygen demand and worsen the situation. A real-life scenario, Mrs. Williams, 66, felt severe pressure in her chest while alone in her living room. She instinctively sat upright in her recliner, keeping her breathing slow and controlled. This posture allowed her to stay alert and respond quickly when she called for help. By the time paramedics arrived, she had maintained her composure and minimized additional strain on her heart. It's also helpful to have supportive objects nearby. A small pillow behind your back or a sturdy chair with armrests can provide extra stability and comfort while waiting for help. The goal is to remain as still and safe as possible without restricting airflow or circulation. Once your body is physically stabilised, the next step involves a life-saving manoeuvre that seniors should know if they are alone. Tip 6, use the cough technique and other self-aid strategies. In certain situations when a heart attack strikes and you are completely alone, knowing immediate self-aid techniques can buy precious minutes until professional help arrives. One method often discussed in medical circles is the controlled coughing technique. While it is not a substitute for emergency care, it can help maintain blood flow and heart rhythm during the very early stages of a heart attack. The cough technique involves taking a deep breath and then coughing forcefully, repeating every 1 to 2 seconds. Each cough should be deep and sustained, not just a short hack. This helps to create pressure in the chest and may assist in keeping blood circulating. While this method is not suitable for all types of heart attacks and should never replace calling emergency services, it can be an additional tool in the moments before help arrives. In addition to coughing, staying mentally alert and using practical self-aid measures is crucial. Loosen any tight clothing around your chest or waist to reduce pressure and improve comfort. Keep a cool, damp cloth on your forehead if you feel sweaty or dizzy. Hydration is important, but only sip water slowly, never gulp, as sudden movement or strain can worsen heart stress. A real-life example, Mr. Chen, 71, experienced sudden chest tightness while alone at home. He remembered advice from his cardiologist and employed the controlled coughing method while seated upright, keeping his breathing slow and steady. At the same time, he had already called emergency services. The coughing technique helped him remain conscious and alert until paramedics arrived. While it's not a guaranteed lifesaver, it can provide critical minutes in extreme situations. Importantly, these techniques require awareness and calmness. Panic can make them ineffective. Practice mental visualization of staying calm, breathing slowly, and following steps you know. Even a few minutes of controlled self-aid can mean the difference between survival and severe complications. Once you've stabilized yourself with self-aid strategies, the final tip focuses on preparing for long-term survival and prevention. Tip 7, prepare your home and your routine for safety. Surviving a heart attack alone is not just about immediate action, it's also about preparation. Seniors can dramatically increase their chances of survival by creating a heart-safe environment and adopting daily routines that reduce risk. Start by making your home accessible. Keep phones and emergency numbers in every room, maintain clear walking paths to prevent falls, and consider medical alert systems that can automatically call for help. Stock aspirin and any prescribed heart medications in easy-to-reach locations. Have a small notebook near your phone listing your medications, allergies, and emergency contacts. Routine also matters. Regular checkups, monitoring blood pressure and cholesterol, and staying active with light exercise like walking or stretching can strengthen your heart and improve recovery outcomes if a heart attack occurs. Diet plays a role too, reducing processed foods, limiting salt and ensuring adequate intake of fruits, vegetables and heart-healthy fats can significantly lower risk. A practical scenario: Mrs. Alvarez, 69, lives alone and takes careful precautions. She keeps her phone on a charging dock in every room, takes her medications consistently, and has installed a simple medical alert device. One morning, she experienced mild chest discomfort while preparing breakfast. Because she had prepared her home environment and routines, she was able to call for help immediately, follow breathing and positioning strategies, and receive rapid medical attention. Her careful planning made all the difference. By integrating these safety measures into daily life, seniors can face the frightening possibility of a heart attack with confidence and preparedness. It's about creating layers of protection, awareness, immediate action, self-aid, and a heart-safe environment. Additional strategies for seniors living alone. While the 7 life-saving tips are the foundation of surviving a heart attack alone, there are additional strategies to consider. These measures may not be immediate life-saving steps, but they greatly improve your overall safety and preparedness. One key strategy is creating a heart attack action plan. This is a simple written outline of what to do if symptoms occur. Include emergency numbers, nearby neighbours or friends who can check on you, locations of medications, and step-by-step instructions. Post it in a visible place such as the refrigerator or near your phone. Knowing that you have a plan reduces panic and ensures that crucial steps are not forgotten in the heat of the moment. Consider technology that enhances safety. Wearable alert devices, smartwatches with heart monitoring, or apps that detect irregular heart rhythms can automatically notify family or emergency services if something goes wrong. These tools are especially valuable for seniors living alone, providing an additional layer of security and reassurance. Nutrition and lifestyle also play a preventive role. Maintaining a heart-healthy diet, exercising within your doctor's recommendations, and controlling blood pressure and cholesterol are proactive measures. While these won't save you during an acute attack, they reduce the likelihood of severe events and support overall heart resilience. Finally, cultivate a support network. Even if you live alone, regular check-ins with family, neighbours or community groups can provide critical oversight. Simple routines, daily phone calls, scheduled walks with a friend, or online support communities create an environment where someone is aware if you suddenly become unresponsive. Dear friends, surviving a heart attack alone is not just about luck, it's about knowledge, preparation, and quick action. Today we've covered 7 critical strategies that every senior should know: recognizing early warning signs, calling for help immediately, staying calm and managing your breathing, taking aspirin or prescribed medications, assuming the optimal position, using self-aid techniques like controlled coughing, and preparing your home and daily routines for safety. Each step is a layer of protection that can significantly increase your chances of surviving a heart attack and minimizing long-term heart damage. It's important to remember that even if you follow every strategy perfectly, a heart attack is still a medical emergency. These tips are designed to help you stabilize your situation and give professional help the best chance to arrive in time. The moments you spend preparing, keeping your phone close, having medications accessible, knowing the warning signs can literally save your life. Let me share a final story that underscores the power of awareness and action. Mr. Harrison, 73, experienced chest tightness while alone in his home. He had practiced heart-safe routines and knew the warning signs. He called 911, sat upright, focused on slow breathing, and took his aspirin. By the time help arrived, he had stayed calm, alert, and responsive. Today, he is enjoying his daily walks and morning coffee. grateful that knowledge and preparation saved him. If you take one thing from this video, let it be this: do not ignore your body's signals and do not underestimate the value of preparation. Every action you take now, learning, practicing and organising, builds a safety net for the moments when it matters most. And if you found this guidance helpful, please take a moment to share it with friends or family, especially those who live alone. Comment below with your thoughts or experiences. Your story could help another senior take action before it's too late. And don't forget to subscribe to the channel for more life-saving health tips designed specifically for seniors like you. Always remember, knowledge is power, preparation is life-saving, and acting quickly can make all the difference. Take care of your heart and take care of yourself. If this video helped you understand how to do that, please give it a thumbs up. It truly helps others find this important information. And if you haven't already, subscribe to the channel and hit that notification bell. Thanks for watching, and as always, stay informed, stay healthy.